I am Anthony Newbold. Welcome to A Closer Look. The coronavirus and its impact on our world is on everybody's lips. And so my guest this week is the Chief Medical Officer of the Bahamas, Dr. Pearl McMillian. Dr. McMillian, welcome to the show.
Thank you for having me.
And thank you I know that you're very busy and you in all these meetings, but let's start at the beginning. We now have a case of COVID-19.
Yes, we do. Yesterday, we would have actually informed that we have a confirmed case of COVID-19 in country.
Yeah. What now? I know that, and I'm talking about the meetings. I know you just came from a high-level meeting. What can you tell me? How does that impact what you're doing?
Okay, so certainly we are well on the way with our response plan, and we continuously meet at the Prime Minister's level to ensure that we have the resources that is required. So that is with a view to ensuring that we have all of the resources that's required for an effective response.
Yeah. Some buzzwords, new buzzwords now in the lexicon. Self-isolation, quarantine, social distancing. Tell me about those. Let's start with the quarantine.
Okay, quarantine is actually when we ask persons to actually separate themselves because there is the likelihood that they would have been exposed. That could be through travel, and because we now have a confirmed case in country, should we move to community spread, it could be, just through socializing. So we may ask a person who has been identified as somebody who was potentially exposed to actually separate yourself, and we will monitor you to determine whether or not you develop symptoms. A quarantined person not having symptoms.
Okay. Self-isolation, quarantine, social distancing. What's social distancing?
Social distancing is a public health measure that seeks to prevent congregation, a aggregate amount of people, and distancing people in the event there is a person in that environment that can potentially spread a particular infectious illness.
Right. So, for example, you go out and you go to a restaurant. They ask you 3 to 6 feet, stay away from.
Well, 3 to 6 feet is definitely one of the measures that we say you want to be away from somebody who is having symptoms, flu-like illnesses.
Yeah.
But social distancing relates to trying not to have large gatherings, trying not to, bring people into a space where there is increased potential for spread of an infectious disease.
Okay. You have a facility identified for quarantine?
Yes, we do. Certainly the Ministry of Health would have started, quarantining returning residents from China when we had put in place the border control and quarantine measures. We still have that facility, and every day we put out a Ministry of Health dashboard that speaks to the numbers we had in quarantine and the number that remain in quarantine.
You have a specific center for testing people?
Yes, we do. The National Reference Laboratory is equipped and has already started the testing. The result that we got yesterday actually came from the National Reference Laboratory. And
we haven't talked about this. I don't hear many people talking about it because I want to ask you about the cost of it, but well, first let me ask you about the cost, because I was going to ask you about insurance and payment for what it's going to cost. What does it cost?
Well, certainly individuals requiring testing will not be, there would be no cost. But generally with public health issues, the cost is secondary to what we need to actually do. So persons will not be asked to pay to have a test done.
Have a test done. A new committee was formed to address this whole COVID-19 virus. What exactly is that committee responsible for?
So that committee is responsible for actually, collectively looking at possible recommendations that can go forward to the Prime Minister and the Cabinet as it relates to measures that we could potentially put in place to decrease the likelihood of spread in the country, to ensure that we protect the economic side of things, to ensure that we protect our tourist product. So it's a pretty wide cross-section of individuals. We have government persons, we have persons from civil society.
Right.
So it's a way for us to actually talk through the issues associated with decisions that may need to occur in order to protect the public.
You said you knew this was out there, and so you've been meeting for a while. Once it was named a pandemic, which means the whole world is
Yes.
impacted.
Worldwide.
And now, of course, we have one case. Your preparedness plans, was it very difficult to ramp up what you were trying to do, or was it helped by the fact that you were meeting for several months?
Well, certainly, I believe that the fact that we were meeting for a few months is good. And certainly the things that we had started to do as it relates to the borders, as it relates to preparing our healthcare facilities, as it relates to, where we would quarantine persons, we have all of those things in place. But we are at a point now where, and this is generally so, once you have a confirmed case in country, you have to ramp up everything even a bit more.
Right.
And certainly, because this is spread through, contact with individuals, contact through surfaces and everything, we have to continue to enhance our communication around prevention measures.
Yeah, because one of the things I was most concerned about, and I think a lot of people are concerned about, including the Prime Minister in his national address, there's been a lot of misinformation out there, especially on social media, about this virus. What specifically do the Bahamian people really need to know? What are the things they most need to be concerned about?
Okay, so the thing that they most need to be concerned about is certainly at the individual level, what is required to decrease your likelihood of becoming infected. And those are the prevention measures that we have had out there for a while, but I will reiterate now. The hand washing, regular hand washing, or using the alcohol-based sanitizers, 60% or more. Certainly, if you feel sick, you want to stay home. Cough in your sleeve, wash your hands properly, but the mass gatherings and coming together in these congregate places, we have to pull back on those. Yeah. Certainly the closing of schools will help because, children are less likely to follow those measures.
Yeah, than the average adult.
Yes.
Anyway, we're going to talk about the healthcare system in general, but we got to take a break, and we'll be back with more Dr. Pearl McMillian after this. Welcome back to A Closer Look. I'm Anthony Newbold speaking with Dr. Pearl McMillian, the Chief Medical Officer of the Bahamas. We're talking about testing, but you wanted to say something about what people need to do.
Just to reiterate, persons who are having flu-like illnesses like cough, sneeze, short cough, fever, not everybody will require healthcare services.
Right.
80% or so of persons likely will not need to go to that level. But if you feel as if your symptoms are, are such that you need to actually go in, then we need you to call ahead. We have already circulated our contact numbers. You can call your physician if you're going to your private physician, but if you are actually going to any of the community clinics, we have contact numbers that we have circulated in order for you to call ahead so that we will prevent actually having persons go into a healthcare facility, and if it is that you are actually having, COVID-19, then you would have potentially exposed others.
Yeah, you're in your mind, from what you've seen, from what you know, as a part of the whole healthcare system, what you've been able to do so far and what you do have in place. You think you're able, with the healthcare system we have in the Bahamas, you are able to deal with what this virus presents to the country?
We are able to deal with it. We would have put in place a plan. We are working with the Princess Margaret Hospital, Doctors Hospital. We're working with our community clinics to ensure that they are actually in a state of preparedness. In the event they have a person who present with symptoms suggestive, they have a clear guidelines as to what they should follow, how they should isolate, health care capacity as it relates to actually being able to treat a person.
Yeah.
We are able to do that, but of course we have to think about the eventuality of us having many cases.
Right.
So you would have referenced the doctor's hospital facility.
Right.
That is one place that we are considering for being able to actually treat additional persons.
Right. That is the doctor's hospital facility on Blake Road.
Blake Road.
Yes. Let me ask you, you're talking about community clinics, for example. Mm-hmm. There was a video circulating about the Fleming Street Clinic. What happened there?
Well, what we had is a person who presented with flu-like illnesses, and certainly a history, a history of travel, but persons, I believe, were at a place of, heightened awareness, and we needed to actually ensure that the persons who were actually supposed to actually treat a person carry out the responsibilities that we have. But when you have the hype around, COVID, sometimes people act in ways that are less than what we would like it to be. But thankfully, we were able to actually manage the situation where we were able to assess the patient and provide the necessary level of care.
Meaning you're asking people not to push the panic button.
Well, no. We are asking people not to push the panic button. We need to utilize the protocols that are available and actually do what we are required to do as healthcare providers and carry out our responsibilities to ensure that persons receive care.
We're talking about clinics, but we're in New Providence. What about the Family Islands? How prepared are they?
We have been working with our Family Islands through our Department of Public Health mechanism. We work with our Family Island community clinics on a daily basis. So what we would have done, we would have early on provided the preparedness plan to them, and we would have been in communication with them and advised that we, would wish for them to engage their island stakeholder groups to put in place a preparedness plan for each of those family islands to ensure that they are able to actually respond in a timely manner in the event they needed to do so.
Yeah.
That would include, having proper identified isolation places in the clinics and having the proper personal protective equipment, which we would have already gotten out to all of our family islands, and also ensuring that if they needed to, use a particular place for quarantine, that was identified. We did have the opportunity to go down to San Salvador and work specifically with that community, and we were able to, talk through a number of those things. And based on the level of response there, I believe our communities in the Family of Islands, they are well on their way.
Something else to challenge you with. This virus is enough on its own. Have the discussions begun, though? We a couple months out from hurricane season.
Yes.
Have you begun the discussions about how you're going to deal with this virus and the possibility that we get hit from a hurricane?
Well, not necessarily the discussions, but what I would say to you is certainly we are, hurricanes are what we do. We have had them for many, many years. Now, we have not even moved beyond Dorian as yet. We are still actually having meetings around, what the health system requires for us to actually get to a place of norm again after Dorian. So we realize that hurricane season is coming and we are dealing with the virus, but I believe because we regularly prepare for hurricanes, we will just seamlessly move into actually making sure that our preparedness activities related to hurricanes will actually begin to occur.
Yeah, and I know that we know that China, which is where this all started, has made an offer to some countries to assist them. But I want you to think about that because I want to ask you about that and a couple other things as we close this out. But we got to take this final break, and we'll be back with Dr. Pearl McMillian talking about coronavirus after this. Welcome back to A Closer Look. I'm Anthony Newbold speaking with Dr. Pearl McMillian, the Chief Medical Officer. I was going to ask you about China and help and all the rest of that, but I think it's best that we kind of go over the elements of this thing and how we're dealing with it in the Bahamian context. We have one case of the virus identified.
Yes, we do. So we have one case, and certainly once you have documented that you have a case in country, the potential for other cases, that's there. So we have to definitely ensure that we are actually, as an individual and as collectively, doing those measures that decrease the likelihood of us getting additional cases.
As a community, as a healthcare system, as the government really, because you're representing them as well, as a Chief Medical Officer, we have the capacity to deal with this.
Yes, we have the capacity. Certainly, we are currently managing the one case, and we have all in our plan. The hospitals have a plan for how they can actually deal with a number of cases. I think it's up to 6 or so. And then we have also taken the responsibility to ensure that we are actually getting the additional capacity in country to be able to manage persons who may require the hospital level care. Most persons will have a mild illness, or they may be asymptomatic. Right. So what would be required at the hospital level is, a smaller number of cases if we should actually have the situation where we're having ongoing, new cases. I truly believe that we still have the opportunity to decrease that likelihood of getting, that exponential increase in cases through the measures that we put in place now. We would have actually started those social distancing measures by saying that schools will be closed, and by saying to individuals that you need to rethink having events that are large gatherings, because the potential of spreading that virus is higher if we actually do those things.
In crowds, because that was my next question.
Right.
What are those things that the Bahamian people can do and should be doing to lessen the chances of this virus being spread? Because after you've done all the things that you do, there's still some personal things that we must do.
Right. So this is a respiratory illness. By that we mean persons will present with, symptoms of fever, cough. You may have running nose, shortness of breath. Certainly you're sneezing. So those things that we usually do to prevent spread of, let's say, the flu, such as covering your cough with your sleeve, not your hands. Certainly making sure you wash your hands often, and making sure if you are not near water sources, soap and water, you utilize the alcohol-based sanitizers, because we tend to put our hands, inadvertently into our faces, and that is how we actually, get infected. Yeah. So if we do those things on an individual level, we decrease the likelihood of becoming infected. If you're having symptoms, if you start to have fever, cough, or any of those things, stay away, self-isolate, stay away from your family. You want to move away from actually coughing around others. That distancing we talk about, 3 to 6 feet, you want to make sure that you are doing that. And certainly if persons are actually around you who are coughing or sneezing, you want to actually move away that 3 to 6 feet to prevent the likelihood of you becoming infected. So those are things that we can do on an individual level. And then at the collective level, if we decrease the mass gatherings and the communal settings, then we will be decreasing the likelihood of us actually spreading the virus, which could potentially, which we know is in country. And certainly if we have one case, the potential is there for us
Yeah.
to actually get additional cases.
And of course, we always have to talk because we're in New Providence. Again, we always have to talk about the Family Islands. You've been in contact with the people in the Family Islands, your people in the Family Islands,
Yes.
to make sure that they are as prepared as they possibly can be?
Yes, we have. We've been working with our community clinics, and we have actually provided them with a plan for how, our preparedness plan, which is not just about health. Our preparedness plan is about the healthcare setting, but also the wider community, and how we will work together to ensure that we are, in the event we had somebody who presented to a healthcare facility, they will actually know how to isolate. But then you may need to have additional, assistance from your wider community in a family island, as we do with hurricanes.
Yeah.
We come together, we have the administrator and others who plan for, what will we do if we had to deal with a particular situation. So that is the methodology we would have used to better prepare our communities and our family islands.
And I'm thinking would be logic, the committee that's been formed to advisory committee really those meetings will continue as time progresses and we see how this thing works its way through the system.
Yes, we have started meeting that advisory committee, and we would have actually put forward a number of recommendations, for consideration as it relates to the social impact, the economic impact, as well as the health impact of what we are dealing with related to COVID-19.
And you, again, have another meeting to go to, but again, you're comfortable with where you are now as far as organizationally, that you're doing all the things that you can do to help to prevent the spread?
Well, what we are doing is rolling out the plan we had. And now that we, in any plan, once you get to a particular point, you may have to revisit and actually, tweak. And we realized that certainly once we had a case diagnosed in country, we would need to ramp up everything we're doing as it relates to the prevention measures. I keep coming back to the prevention measures.
Important.
Certainly we would have actually looked at, additional capacity for actually caring for persons. We have those things already in train, but now we need to focus and ensure that we get those things to, completion. In the event we have that exponential increase, which is what we are truly seeking not to have by putting in the measures that we are doing at multiple levels. The government, the highest level, they are actually, taking decisions to close schools. The civil organizations, they're saying, okay, we will not have this event.
Right.
So the churches may need to say, maybe we may need to have church from a distance, because we need to do everything as a country to decrease the likelihood of us actually having wider spread. And we need to protect the vulnerable among us, and it's the older persons in the communities and those with the underlying illnesses that has been shown to be most negatively, impacted by this COVID-19 infection. So as we continue to move forward with our plans, and as we, work together, not just health, but with the wider society, I truly believe we as a country, we will be in a good place as it relates to how we, respond to what we kind of knew a little, once we saw moving toward the pandemic stage, we kind of knew we would have a case, but now that we do, we are truly seeking to decrease the likelihood of us getting additional cases. And if we do get cases, we have to be prepared to treat them, and we are well on our way with actually doing that. So we are actually moving to continue our process of planning and implementing our plan. So I would want the Bahamian people to know that we are, as health, doing our part and working with our stakeholder groups to ensure that we are in a position to respond to COVID-19, which we know we have in our country now.
Thank you very much, and good luck with all that you do.
Thank you.
And thank you for watching. Remember, you can also watch us on Facebook and on YouTube.